A patient asks a nurse what are neurotransmitters. My doctor says mine are out of balance. What is the nurse's best response? Answer: neurotransmitters are chemicals that pass messages between brain cells. Stating that neurotransmitters are chemicals that pass messages between brain cells gives the most accurate information. Neurotransmitters are messages or messengers in the central nervous system. They are released from the axon terminal, diffuse across the synapse, and attached to specialized receptors on the postsynaptic neuron. The incorrect responses do not answer the patient's question, are demeaning, and provide untrue and misleading information. Next, the parent of an adolescent diagnosed with schizophrenia asks a nurse, my child's doctor ordered a positron emission tomography or a PET scan. What is that? What is the nurse's best response? Answer is PET is a special scan that shows blood flow and activity in the brain. The parent is seeking information about PET scans. It is important to use terms the parent can understand. The correct option is the only reply that provides factual information relevant to PET scans. The incorrect responses describes magnetic resonance imaging, computed tomographic scans, and electroencephalography. A patient is demonstrating signs of dementia. The healthcare provider wants to make a differential diagnosis between Alzheimer's disease and multiple infarctions. Which diagnostic procedure should a nurse expect to prepare the patient for first? The answer is a CT scan or a computed tomography. A CT scan shows the presence or absence of structural changes, including cortical atrophy, ventricular enlargement, and areas of infarction. Information that will be helpful to the healthcare provider. The other test focuses on brain activity and are more expensive. They may be ordered later. Next, a patient has delusions and hallucinations. Before beginning treatment with a psychotropic medication, the healthcare provider wants to rule out the presence of a brain tumor. For which test will a nurse need to prepare the patient? The answer is a CT scan or an MRI. A CT scan or an MRI visualize neoplasms and other structural abnormalities. A PET scan, SPECT scan, and an fMRI, which give information about brain function, are not indicated. An arteriogram would not be appropriate. Next, the nurse wants to assess for disturbances in circadian rhythms in a patient admitted for major depressive disorder. Which question best implements this assessment? The answer is, how would you describe your sleep pattern? Mood changes throughout the day are related to circadian rhythms. Questions about sleep pattern would also be relevant to circadian rhythms. The question about seeing or hearing things is relevant to the assessment for illusions and hallucinations. The question about thinking is relevant to the assessment of thought process. The other question is relevant to assessment of memory. Next, a nurse administers a hypnotic medication that potentiates the action of gamma aminobutyric acid or GABA. Which finding would be expected? Answer is reduced anxiety. Increased levels of GABA reduce anxiety. Thus, any potentiation of GABA action should result in anxiety reduction. Memory enhancement is associated with acetylcholine and substance P. Thought disorganization is associated with dopamine. GABA is not associated with sensory perceptual alterations. Next, on the basis of current knowledge of neurotransmitter effects, a nurse anticipates that the treatment plan for a patient with memory difficulties may include medications designed to do what? Answer is prevent destruction of acetylcholine. Increased acetylcholine plays a role in learning and memory. Preventing the destruction of acetylcholine by acetylcholinesterase results in higher levels of acetylcholine, with the potential for improved memory. GABA is known to affect anxiety level rather than memory. Increased dopamine causes symptoms associated with schizophrenia or mania rather than improves memory. Decreasing dopamine at receptor sites is associated with Parkinson's disease rather than improving memory. Next, a patient demonstrates disorganized thinking related to a diagnosis of schizophrenia. Neuroimaging would most likely show dysfunction in which part of the brain? The answer is the prefrontal cortex. The prefrontal cortex is responsible for intellectual functioning. The temporal lobe is responsible for the sensation of hearing. The cerebellum regulates skeletal muscles, coordination, and equilibrium. The brainstem regulates internal organs. Next, a nurse should assess a patient taking a medication with anticholinergic properties for inhibition of what function? The answer is the parasympathetic nervous system. Acetylcholine is the neurotransmitter found in high concentration in the parasympathetic nervous system. When acetylcholine action is inhibited by anticholinergic drugs, parasympathetic symptoms such as blurred vision, dry mouth, constipation, and urinary retention appear. The functions of the sympathetic nervous system, the reticular activating system, and the medulla oblongata are not affected by anticholinergic medications. Next, the therapeutic action of monoamine oxidase inhibitors, or MAOIs, blocks neurotransmitter reuptake, causing what effect? Answer is increased concentration of neurotransmitters in the synaptic gap. If the reuptake of a substance is inhibited, then it accumulates in the synaptic gap and its concentration increases, permitting the ease of transmission of impulses across the synaptic gap. Normal transmission of impulses across synaptic gaps is consistent with a normal rather than a depressed mood. The other options are not associated with blocking neurotransmitter reuptake. Next, a patient taking an antipsychotic medication develops restlessness and an uncontrollable need to be in motion. A nurse can correctly analyze that these symptoms are related to which drug action. The answer is dopamine blocking effects. Medications that block dopamine often produce disturbances of movement, known as extrapyramidal side effects, such as akathisia, because dopamine affects neurons involved in both the thought process, and movement regulation. Anticholinergic effects include dry mouth, blurred vision, urinary retention, and constipation. Akathisia is not caused by endocrine stimulation or spinal nerve stimulation. Next, a patient presents with anxiety, increased heart rate, and fear. The nurse would suspect the presence of a high concentration of which neurotransmitter? Answer is norepinephrine. Norepinephrine is the neurotransmitter associated with sympathetic nervous system stimulation, preparing the individual for fight or flight response. GABA is a mediator of anxiety level. High concentration of histamine is associated with an inflammatory response, and a high concentration of acetylcholine is associated with parasympathetic nervous system stimulation. Next, a patient reports symptoms of acute anxiety related to the death of a parent in an automobile accident 2 hours earlier. The nurse should anticipate administering a medication from which group for a short-term therapy. Answer is benzodiazepines. Benzodiazepines provide anxiety relief but are losing favor among providers due tolerance, high levels of abuse, and recent connects to dementia. Tricyclic antidepressants are used to treat symptoms of depression, and anticonvulsants are used to treat bipolar disorders or seizures. Antipsychotic drugs are used to treat psychosis. Next, a patient is hospitalized for major depressive disorder. A nurse can expect to likely provide the patient with teaching about which medication. Answer is fluoxetine or Prozac. Fluoxetine is a selective serotonin reuptake inhibitor, SSRI, an antidepressant that blocks the reuptake of serotonin with few anticholinergic and sedating side effects. Clozapine is an antipsychotic medication. Chlordiazepoxide is an anxiolytic drug, and Tacrin is used to treat Alzheimer's disease. Next, a patient hospitalized with a mood disorder has demonstrated aggression, agitation, talkativeness, and irritability. A nurse begins the care plan based on the expectation that the healthcare provider is most likely to prescribe a medication from what classification? The answer is a mood stabilizer. The symptoms describe a manic episode. Mania is effectively treated by the mood stabilizing medication. Lithium and selected anticonvulsants such as carbamazepine, valproic acid, and lamotrigine. No drugs from other classifications listed are effective in the treatment of mania. Next, a patient described a muscarinic receptor blocker will require assess for what side effect. Answer is dry mouth. Muscarinic receptor blockade includes atropine-like side effects such as dry mouth, blurred vision, and constipation. Gynecomastia is associated with decreased prolactin levels. Movement defects are associated with dopamine blockade, and orthostatic hypotension is associated with alpha-1 receptor antagonism. Next, a patient begins therapy with a first-generation antipsychotic medication. What teaching should a nurse provide related to the drug's strong dopaminergic effect? The answer is report muscle stiffness. First-generation antipsychotic medications block dopamine receptors in both the limbic system and the basal ganglia. Dystonia is likely to occur early in the course of treatment and is often heralded by sensations of muscle stiffness. Early intervention with anti-Parkinsonian medication can increase the patient's comfort and prevent dystonic reactions. The incorrect responses apply to potential anticholinergic effects of first-generation antipsychotic medications. Next, a nurse can anticipate anticholinergic side effects are likely to occur when a patient is prescribed what medication? The answer is fluphenazine. Fluphenazine is a first-generation antipsychotic medication. It exerts muscarinic blockade resulting in dry mouth, blurred vision, constipation, and urinary retention. Lithium therapy is more often associated with fluid balance problems, including polydipsia, polyuria, and edema. Risperidone therapy is more often associated with movement disorders, orthostatic hypotension, and sedation. Buspirone is associated with anxiety reduction without major side effects. Next, priority teaching for a patient taking clozapine should include which instruction? The answer is report sore throat and fever immediately. Clozapine therapy may produce granulocytosis, which is a rare but serious decrease in granulated white blood cells. Therefore, signs of infection should be immediately reported to the healthcare provider. In addition, the patient should have white blood cell levels measured weekly. The other options are not relevant to clozapine administration. Next, the nurse will order a special diet for the patient taking what medication? The answer is phenelzine. Patients taking phenelzine, an MAOI, must be on tyramine-free diet to prevent hypertensive crisis. None of the other medication require dietary restrictions. Next, a nurse caring for a patient prescribed a selective serotonin reuptake inhibitor will develop outcome criteria related to what outcome? The answer is mood improvement. SSRIs affect mood, relieving depression in many patients. SSRIs do not act to reduce thought disorders. SSRIs reduce depression but have little effect on motor hyperactivity. SSRIs do not produce extrapyramidal symptoms. Next, a patient's partner who is a chemist asks a nurse how serotonin reuptake inhibitors, SSRIs, lift depression. What response will the nurse provide? Answer is makes more serotonin available at the synaptic gap. Depression is thought to be related to the lowered availability of the neurotransmitter serotonin. SSRIs act by blocking the reuptake of serotonin, leaving a higher concentration available at the synaptic cleft. They actually prevent the destruction of serotonin, have no effect on acetylcholine and dopamine production, and do not block muscarinic or alpha-1 norepinephrine receptors. Next, a patient has taken many conventional antipsychotic drugs over the years. The healthcare provider, who is concerned about early signs of tardive dyskinesia, prescribes risperidone. A nurse planning care for this patient understands what fact about second-generation antipsychotics? The answer is they produce fewer motor side effects. Second generation antipsychotic drugs often exert their action on the limbic system rather than the basal ganglia. The limbic system is not involved in motor disturbances. Atypical antipsychotic medications are not more readily available. They are not considered to be of higher potency. Rather, they have different modes of action. Second generation antipsychotic drugs tend to be more expensive. Next, the laboratory report for a patient taking clozapine indicates the patient is experiencing agranulocytosis. The nurse should implement which intervention first? Answer is report the laboratory results to the healthcare provider. These laboratory values indicate the possibility of agranulocytosis, a serious side effect of clozapine therapy. These results must be immediately reported to the healthcare provider. The drug should be withheld because the healthcare provider will discontinue it. The healthcare provider may repeat the laboratory test, but in the meantime, the drug should be withheld. Giving aspirin and forcing fluids are measures that are less important than stopping the administration of the drug. Next, a nurse administering psychotropic medications should be prepared to intervene when giving a drug that blocks the attachment of norepinephrine to alpha-1 receptors because the patient may experience what effect? Answer is orthostatic hypotension. Sympathetic mediated vasoconstriction is essential for maintaining normal blood pressure in the upright position. Blockage of alpha-1 receptors leads to vasodilation and orthostatic hypotension. Orthostatic hypotension may cause fainting and falls. Patients should be taught ways of minimizing this phenomenon. Next, a nurse prepares to administer an antipsychotic medication to a patient diagnosed with schizophrenia. Additional monitoring of the medication's effects and side effects will be most important if the patient is also diagnosed with which health problem? Select all that apply. Answer: Parkinson's disease, epilepsy, and diabetes. Antipsychotic medications may produce weight gain, which complicates the care of a patient with diabetes, or lowers the seizure threshold, or both, which complicates the care of a patient with epilepsy. Parkinson's disease involves changes in transmission of dopamine and acetylcholine, therefore these drugs also complicate the care of a patient with the disorder. Osteoarthritis and Graves' disease should have no synergistic effect with this medication. Next, the spouse of a patient diagnosed with schizophrenia asks which neurotransmitters are more active when a person has schizophrenia. The nurse's response will focus on which neurotransmitters. Select all that apply. Answer is dopamine and norepinephrine. Dopamine plays a role in the integration of thoughts and emotions, and excess dopamine is implicated in the thought disturbances of schizophrenia. Increased activity of norepinephrine also occurs. Substance P is most related to the pain experience. Histamine decrease is associated with depression. Increased GABA is associated with anxiety reduction. Next, an individual is experiencing problems associated with memory. Which cerebral structures are most likely to be involved in this deficit? Select all that apply. The answer is prefrontal cortex, temporal lobe, and parietal lobe. The prefrontal cortex, parietal, and temporal lobes of the cerebrum play a key role in the storage and processing of memories. The occipital lobe is predominantly involved with vision. Basal ganglia influence the integration of physical movement as well as some thoughts and emotion.